May dagdag na paraan laban sa COVID-19. Together, we can be the Solusyon Plus. Bida Plus sa maayos na daloy ng hangin. Bida Plus sa maikling pisikal na interaksyon. Bida Plus sa pagsuporta sa bakuna. Bida Plus sa mga kwento ng kaligtasan sa Bida Barangay. Sa dagdag na pag-iingat, maraming buhay ang maliligtas. Bida Solusyon Plus laban sa COVID-19.
Organic acai has very high levels of antioxidants and essential nutrients that help keep your immune system strong. Organique acai premium blend and freeze-dried capsules daily to help increase your resistance against harmful viruses. Keep yourself and your family healthy and protected with Organique.
Mahalagang paalala, ang Organic Acai Premium Blended Freeze-Dried Capsule ay hindi gamot at hindi dapat gamitin panggamot sa anumang uri ng sakit. Of all the tough decisions you have to make today, your family's health doesn't have to be one of them. Not when you have the choice to go organic and live full, natural, and holistic lives. So start your day right. Load up on antioxidants. Choose only organic superfoods. And keep the momentum going. We're making it easy for you. Live organic, choose organic. It's easier than you think. Mahalagang paalala, ang Organic Acai Premium Blended Freeze-Dried Capsule ay hindi gamot at hindi dapat gamitin panggamot sa anumang uri ng sakit.
Previously on Wellness
Kasi
Wednesday.
minsan, we have a lot of factors to consider. So, una nga, because of the changing weather natin, you know what, parang minsan kasi it's confusing, di ba? Na parang yung mga signs and symptoms ni colds kasi, ay minsan, bakit
Wellness Wednesdays with Organique. We care because you matter.
In support to DOH Bida Solusyon campaign.
Oh, there we go. My mic was on mute. Sorry about that. Hello again. Good afternoon. Welcome to Wellness Wednesday. I hope you all are all having a wonderful afternoon and a good start to the March month, like the third month of 2021. When did that happen? We're about to celebrate our 1 year anniversary of this pandemic. But before moving on to today's topic, I just wanted to invite you guys to join our Facebook game here at Organique Inc. So here on our Facebook game, you can check out this post and then you can comment whether it's true or false if our Organique Acai Premium Blend is actually 100% vegan. What do you guys think? Now, if you comment on this post, hopefully you get a chance to win our Organique gift pack. And here it is. So our Organique gift pack will include either acai coffee or acai choco trade box, as well as our freeze-dried acai capsules. Now, these are actually like the best way to start your morning. As in, when you wake up in the morning, you need to feel refreshed. You need to get that energy. So yun, mga viewers natin. And then the choice is yours as well. And then this, especially, I think what you learned today in our today's segment is just the importance of boosting your immune system. Now, so speaking of boosting our immune system, as you very well know, here right now, we are still experiencing the pandemic that is COVID-19. Pero even with COVID-19 there are still other viruses that we should be aware of. COVID-19 is not the only virus that we should try to stop ourselves from getting, and prevent the spread of. So what is a very important virus? Well, actually, did you know some viruses can cause cancers, such as HPV? Now, we're going to be having one of the leading OB-GYNs here in the country to talk more about that. But before I invite her to talk here, I just want to let you know that in the US, cervical cancer used to be one of the leading causes of death among women. Pero with the proper preventative techniques, especially against HPV, they were able to reduce it to one of the lowest causes of death amongst women. Pero here, dito sa Pilipinas, it's still one of the leading causes of death. So to talk to us more about that today here, we have Dr. sorry, dry throat. We have Dr. Michelle Dado from the Philippine sorry, I'm going to get confused on this word, obstetrical and gynecological society. So Dr. Michelle, if you could say hi to our viewers today.
Hi, everyone. Hi, Luisa.
Hi, Doc.
I hope everyone's
How
safe
are
at home.
you? Yes,
I'm
exactly.
good. I'm excited to talk about our topic.
Yeah, Doc and I were actually like in the green room, the virtual green room. We were discussing about this earlier, and both of us are super, super excited to talk about cervical cancer, especially since it's International Women's Month, diba, Doc?
Yes. So perfect time to really talk about things about women. So it's a perfect first Wednesday of the month.
Yes, exactly. And sa mga male viewers natin, I still invite you to watch this because, we all have a few women who are very close to us in our lives, and it's very important to be also cautious and aware of their health as to how we can best support our women out there.
Mm-hmm.
So I just want to dive right into the topic, Doc. So first of all, can you tell us what is cervical cancer?
Okay, so before I talk about cervical cancer, let's talk about what the cervix is first. Okay, the cervix is actually the neck of the uterus, Luisa. It's sa Tagalog, siya yung tinatawag na kwelyo ng matres. So it's the entryway into the into the uterus. So cervical cancer is when you have the cells of the cervix become, what do you call this, crazy, di ba? Medyo nagkakaroon na ng problema, nagkakaroon ng pangit na development, tapos nagkakaroon ng sakit yung mga cells dun sa cervix o sa kwelyo ng matres.
Right. And then so, Doc, what are the symptoms of cervical cancer?
Okay, there are several symptoms of cervical cancer. However, unfortunately, early on, yung early stages, walang nararamdaman ng pasyente. So they don't feel anything. It's when it's in the advanced stage na marami nang nararamdaman ng pasyente, like bleeding during and after sex, pain during and after sex. There's unusual bleeding, so you have on and off spotting, and you may actually have foul smelling discharge coming from your vagina continuously if it's in the very late stage already of cervical cancer.
Doc, so actually, how long does it take before you start to notice yung mga symptoms?
Nako, Luisa, matagal. It takes several years for the cancer to really develop. So initially wala talagang symptoms. So it's very important nga yung screening talaga para malaman mo if you have cervical cancer, kasi later stage na yan, about more than 5 years before you really notice the symptoms, unless it's a very aggressive type of cancer na sobrang bilis naman na ng progress, na alam mo yon, yung she developed lang a certain like lesion, tapos in a few months time pumangit na talaga yung cancer.
Right. So, Doc, by the time I start to notice these, it's already, would you say it's too late now, or can something still be done about them?
Well, ano tawag dito, kung andun ka na sa talagang yung lagi na may foul smelling discharge, na mabaho na yung lumalabas sa puwerta na discharge, na tuloy-tuloy, medyo late stage na talaga yon. So, mas maganda na yung mga like bleeding after what you call this after sex, kung medyo madalas na nangyayari yon, it would be good to already consult your doctor about it. So anything that's abnormal, anything that's not supposed to be coming out of the vagina at that time of the month, kung nagbi-bleed kang tuloy-tuloy, it's best to like see your doctor talaga.
Right. Pero Doc, I just noticed that yung symptoms that you mentioned, they're actually very common to a lot of other diseases or abnormalities that can be associated. For example, UTI or situations where I've heard when a woman has sex for the first time, sometimes she might experience bleeding. No?
Yes,
So how
yes.
would I know whether the symptoms I'm experiencing are cervical cancer or something very mild?
Okay, this is, Luisa, itong mga sinasabi kong symptoms, kasi yung bleeding after the first time that you have sex, medyo expected yun eh, 'di ba? Kasi napunit yung hymen mo eh. Pero pag recurrent, meaning paulit-ulit, then that's the time actually that you have to now think na, uy, teka muna, hindi na normal to. So mas maganda kung makita mo na yung doctor. That you're right, totoo yung sinasabi mo na nakikita siya sa maraming other diseases. So again, uulitin ko, importante na pag may naramdaman, go see your doctor agad. So mas maganda na yung OA tayo, yung medyo OC tayo, kaysa yung, ay, wala yan. So it's nothing. I will just observe it first. Mas maganda na medyo OC tayo. But in this pandemic, it's kind of hard, Luisa, right? Kasi not everyone wants to go face-to-face pa. So, there's already the platform available ng telemedicine. So, you can actually call your doctor, consult with her. Siguro don't show na lang your, you just describe to her na lang. It's kind of funny naman, to show whatever you need to show. So, kasi naman, as doctors, if we need to examine you, we will tell you to come to the clinic.
I think you might show the wrong thing. Maybe the doctor has one thing she wants to examine, and you might be showing something else.
Exactly.
Have you had those incidences, Doc, na may pasyente that tried to show you like, oh, Doc, can you check this out, please? Like on teleconsult.
No naman, actually, it's a good thing wala pa akong experience na ganon. But most of them, they are actually, I asked them to describe. So they describe to me what they see. So I try to educate them about the different kinds of discharges, and I try to ask them what they see, so that I can at least make a deduction on what they're feeling and what the problem is.
Okay. Well, speaking of the different kinds of discharges, Doc, can we just talk about what women should expect to see versus when should you go see your OB/GYN with regards to possible cervical cancer?
Okay, so there's normal discharges and abnormal discharges. Like
Mhm.
every time you go, so it really depends on the time of the month. So during the time that you're having menstruation, so syempre it's blood. After that,
Mhm.
after like 5 to 7 days, you start noticing a egg white like discharge. It's slimy, it's colorless, it's opaque. So pwede siyang or pwedeng may konting color. It's like white to a little light yellow. It would last for mga 1 to 1.5 weeks. After that, it gets converted to this white pasty kind of discharge para siyang kanin na pinisa. Okay, na buo-buo. So mga two, mga at least 'di ba they can so yung isa egg white.
Yes, yes, yes.
Okay. So okay, now you know you go to your kitchen while you're watching this Facebook live. Pagbukas ng itlog, okay, the egg white discharge, that's after menstruation, so that means you're fertile. And then it gets converted to the parang kanin nga na pinisa, na buo-buo, na 2 weeks yon. So these are normal discharges. And there's no
Mhm.
smell, hindi makate. Okay, so ito yung mga normal discharge. So anything that's dark yellow, yellow-green, has smell, or is blood tinged, merong dugo or brownish, is not normal. So lalo na yung mga merong parang fishy odor, yung medyo malansa, it's not normal. Tsaka makate, it's not normal.
Right. How about the doc, like after your period? I know some women experience spotting after their period. So, would like if they experience like brown discharge, then is that considered abnormal?
Okay, there are some women na yung tinatawag natin na taghabol, meron pang spotting, that would be, as long as it's still within the 7 days, that's allotted to the normal length of menstruation, then that's still normal. But if you have, sabi ko nga, if once or twice, sige, okay lang, you can still observe. But if it's always happening every month or it's recurrent, it happens for several months and then it goes away, tas ayan na naman, uulit na naman, then I think it would be best to see a doctor, diba? Para ma-check kung ano yung cause ng spotting na yun or yung discharge na yun.
Okay. And then, so doc, what are the typical causes then of cervical cancer?
Okay, majority of cervical cancer now is attributed to the human papillomavirus. So, infection siya. Okay? And the rest, mga 90% yon. And the 10% is now a mixture of genetics and lifestyle.
Right, right. So like most other cancers, no, yung 10%.
Yes, yung 10%. Pag meron
So,
kang kapamilya, ganon.
yes. So, doc, I noticed actually that here that cervical cancer, HPV is quite common. When I was also doing research before this show, they said that it's universal across sexually active adults. So,
Yes.
how common are we talking about?
75 to 80% of men and women will have an HPV infection in their lifetime. Yes, at least one HPV infection in their lifetime. And sobrang malas ka if you get the strain that actually causes cancer. There are more than 170 strains of human papillomavirus or HPV. Tapos 12 dun sa 170 strains na yon, cancerous. Diba? So, sobrang malas ka if you get that. Yeah, oh. And it's not just for women, hindi lang pang babae, pati lalaki kasi it's sexually transmitted, so pasa-pasa siya. And actually dito sa Philippines, equal lang yung guy to girl and girl to guy. And guy to guy. Yeah.
Right. So, while we're talking about cervical cancer, doc, what you're saying is yung HPV virus is not limited to cervical cancer, but other forms of cancer that can also be applicable to men, no?
Yes, oo. Hindi lang cervical cancer. Some HPV strains also causes genital warts. Yung mga kulugo dun, pero kulugo dun sa sa feminine area, tsaka sa lalaki din.
Right.
Hindi yung mga warts dito ha, kasi ibang patients nagpapanik eh. Okay, it has to be there, genital warts.
Right. So if you have genital warts, doc, does that mean that I have the HPV that causes cancer ba?
Okay, usually the HPV that causes genital warts is HPV 6 and 11. What causes cancer is some of the strains that causes cancer is 16, 18, 51, 52, and 45. Okay, yung 6 and 11, it makes you
Okay.
a
So they're
little
not
more
really.
prone. Yes, it makes you a little more prone to developing cancer, cervical cancer kasi you don't just get naman the warts lang ng basta-basta. It's sexually transmitted. So, it causes some problems also in the cervix. So, making you a little more prone also to develop cancer, cervical cancer.
Well, Doc, you said that HPV is very common, no, across the board. That 75%
Yes.
of the
Mm.
adults will get it once in their lifetime. But then, what I understand is, mga STIs and STDs are typically, for a lifetime. They're uncurable. So, is that correct, Doc?
So, well, once you're a carrier, you are technically almost always forever a carrier, diba? Kaya nga, what do you call this? But sa HPV kasi, there is a way to be able to protect yourself. So, the earlier that you get it, when you're not yet sexually active, then the better it is, the better it will protect you. However, if you are sexually active already, tas you get the vaccine, andyan pa rin yung HPV, hindi siya cure, okay? Pero it will now, kumbaga parang ano yan eh, kung andito yung HPV, tapos ganyan, gulo-gulo si HPV, ang gagawin ng vaccine, tatakpan niya si HPV. So hindi masyadong makaka-spread si HPV. So yun ang magiging effect ng vaccination.
So, is there a point, Doc, where it's too late to get the vaccine na?
Well, kasi yung recommendation is until 45 years old. However, merong tinatawag kaming off-label vaccinations wherein we give it to older women who are at a higher risk. Say, for example, may family history or nakita talaga in the screening na meron siyang HPV sa cervix niya, then pwede ibigay ang vaccination.
Okay. And then vaccine is for men and women, no? Kasi men
Men
can
and
be the
women,
ones
yes.
to transmit HPV and risk of cervical cancer to women.
And vice versa, ganun din. Pwede rin namang silang mahawa ng partner
Right.
nila. Yeah.
Okay. So, Doc, who is more at risk then of developing cervical cancer if HPV is very common across the board?
Okay. Yung marami kasing, sabi nga, diba, everyone is at risk. And so WHO is making all doctors, all of us obstetricians assume that everyone has an HPV. But yung
Right.
mga at a higher risk, yung medyo maagang nakipagtalik or early sex, like mga 15, 16, they engaged in sex already. Much worse if you engage in sex at around mga 12 or 13, diba? So, ganon.
Yeah.
Next, multiple sexual partners. Yung madami kang partner, yung, well, sampling fruit? Yun ba yung tawag doon? Okay, so multiple sexual partners, and then there are some studies that say that if you're taking the birth control pills and it's been more than 5 years, you are at a higher risk of developing, you may be at a higher risk of developing cervical cancer. Pag nagsusmoke, kasi bumabagsak ang immune system, hindi ganun kaganda ang circulation. So, pangit ang panlaban mo sa kahit anong virus. So, that makes you actually a little more prone also to developing cervical cancer. And then yung weak din ang immune system, yung sakitin ka, hindi ganun kaganda ang laban mo sa mga infection. Ang virus, pag maganda ang immune system mo, kaya mo siyang labanan, diba? And then finally, pag yun nga, meron ka, ikaw mismo, nagkaroon ka ng sexually transmitted infection or ang partner mo ay nagkaroon ng sexually transmitted infection kasi pwedeng ipasa sa'yo. And finally, kung say for example, ikaw, wala ka namang multiple sexual partner, pero yung bago mong partner, nagkaroon ng maraming partners, so na-expose siya, exposed ka rin. So that makes you at risk also.
Right. So, Doc, we have a question here from Chris Marie. She said, mahal po ba ang vaccine?
Well, Medyo it's definitely more than 2,000 pesos. Okay, ang mga vaccines. May ilang klase ng bakuna ngayon. The more recent and the more yung coverage, mas mahal. Ang bakuna kasi hindi natin pwedeng sobrang murahan kasi dinidevelop yan maraming mga pag-aaral, tas maraming ilinalagay dyan. So, medyo mahal talaga ng konti. Maganda kung i-discuss mo with your doctor yung sa bakuna.
Right.
Tsaka
So
ano
I
naman,
think
if you
also, yeah, go
yeah,
ahead,
and if
Doc.
you think about it, sorry, Luisa, if you think about it, ang medyo gastos, I tell my patients, ang medyo magastos lang is the first dose. Kasi outright mong ilalabas eh. But the second and the third dose, like say for the second dose, you have 1 to 2 months to prepare for it now. So kahit magtabi ka every day for it. Tapos lalo na yung last dose, which is 6 months after the first dose. Meron kang 6 months na pwede magtabi or magsubi para doon. So, ang medyo mabigat lang yung unang dose. Just the first dose. After that, it's less than 50 pesos per day eh. Parang ganun ang itatabi mo just to get the vaccine eh. So, if you look at it that way, medyo parang mas madaling tanggapin, 'di ba?
Yeah, well, thanks for the practical saving tip there, Doc. But I also think that, for ang mga viewers natin, that cancer is way more expensive than a vaccine.
Exactly.
Yes. So if you think of it that way also, yeah. So if you think of it that way also, then it's more incentive. Hopefully, my pros to saving for you guys and for your kids as well, no? Kasi we want to be able to protect our kids before they become adults and then put themselves at risk. So
exactly.
there's another question here. Yeah, there's another question here, Doc, from Joanne Nardo, who says, question po, pag nagpa-vaccine na po ako before, pwede pa po magpa-vaccine ulit?
Joanne, actually, once you get the vaccine, okay ka na. Lifetime protection na yan. So far, and up to this point in time, wala pang sinasabi na kailangang booster ang HPV vaccine. So, protected ka na.
Wow. So, see? More sulit than you think.
Yes, diba? Oh.
Yes. So here we have another one from Renfrey Lopez. It says, Dr. Marie, pwede po bang magpa-vaccine kahit meron na HPV?
Yes, pwede pa actually. Renfrey ba to? Yes, you can. Sabi ko nga, diba, if you're sexually active already and then you get the vaccine, ang gagawin niya, papahinain niya yung virus na para hindi ito magkukos ng sakit sa'yo. So, andyan siya, pero mahina lang siya. Yun ang magiging work ng vaccine. So, di ba, mas maganda na yun kaysa walang vaccine.
Yes. So, protect again yourself and then your partner. And then, Doc, I actually wanted a few more questions about yung risk factors. So, if you could bring that slide up. So, sa risk factors, Doc, I noticed the first point here is if you have sex when you're younger. Pero I think the problem here, Doc, is if you have sex when you're, say, a minor, how can you go to the OB-GYN to get checked and you don't want to tell your parents?
Yun nga, that's the problem. Kasi here in the Philippines, hindi pa tayo ganun ka-open na gaya ng sa States na they can actually consult already. But the best thing is really to talk to your parents. Alam mo, sabihin mo na lang meron ka nararamdaman and that you need to see a doctor. Kasi ano naman ngayon it would be better to be open about it kaysa, alam mo yun, kaysa too late the hero, may problema na, saka tayo kukonsulta, diba? So, pero malaking issue yan, Luisa. It's a problem, I think, na I don't know how we're going to solve that kasi most parents, I think naman, pag nagsabi naman sasabihin naman ng bata, nako, pag nagsabi ako sa mami ko, patay na ako, hindi na ako makakalabas sa bahay, diba? But for parents siguro din, diba, siguro advice for parents I think it's not really more of allowing your kids, but it's keeping the avenues of conversation open na para kayo ang matatanong ng mga anak nyo tungkol sa mga bagay-bagay na to, kahit bata pa sila, para hindi sila nagtatanong sa mga kaibigan or hindi sila nag-experiment. Kasi most of the time, yung engaging in sexual activity in adolescents, it's really more of experimental eh. They're curious, 'di ba?
Mhm.
Tapos nakikita nila sa social media or nakikita nila sa TV na okay, so they become curious. But if the avenue is open na pag-uusapan kahit sa simpleng paraan, I think mas kasi studies have shown na ang pamilya na bukas ang pag-uusap, mas less ang likelihood na ang mga anak mag-engage in premarital sex, in drugs, or in too much alcohol intake. So, there.
Right. And then
Hirap,
I
no?
think I want to add to that, Doc. I think I want to
Yes.
add to that, Doc, is
Mm.
so mga parents, like, sometimes, as much as possible, you want to protect your children. Pero the best protection here is to just offer the vaccine early to them, because we cannot
Yes.
control their actions. Pero the
Yes.
vaccine at least has a my safety
Yes.
net siya. And then another
Oo.
thing is,
Kasi
Doc,
they're,
yeah, go ahead.
mm. No, I'm listening. Go. Sige, go ahead.
Okay, okay. Another thing is, Doc, while we were discussing before this live stream commenced, we were talking about how barangay health centers, my obegaini that you can go visit, no? So then
Yeah.
once you turn 18, if you really, really cannot tell your parents, no, once you turn 18, then you can go visit them by yourselves.
Yes, exactly. Oo. Exactly. So I agree with that. Early vaccination, takot lang kasi ng mga parents na pag binakunahan baka maging promiscuous ang patient ang kids nila. Hindi totoo 'yon, 'di ba? This is actually a gift you can give to your kids, 'di ba? Vaccination. Tas tama 'yon. Once you're 18, automatic lang, alam mo 'yon, hindi naman kailangan meron kang nararamdaman to see a doctor eh. Alam mo 'yon, may baseline lang. 'Yun ang maganda.
Yes. And then, Doc, so I have more questions about yung risk factors. So
Okay.
yung multiple partners, so do I have
Mm.
to get checked more often if I have more partners?
No, it's still routine naman na you go for checkups twice to once to twice a year unless you have symptoms. So
Mhm.
so ang solution diyan, monogamy. Stick to one.
Even if that person has a history, Doc, so monogamy is still safer.
Yes, oo. Pero yun nga,
Yeah.
check up once to twice a year unless they have symptoms.
So, Doc, I was actually talking to my OB-GYN a few months ago, and she was saying that women are actually more at risk of getting HPV than men
Mhm.
from their partners. I think she was saying something like, while men, it would take more partners for them to get
Mhm.
HPV, women
Mhm.
can actually just get it from one.
Mhm.
Is
Mhm.
that true?
Yeah, I agree. Okay, pero at the end of the day, it just takes one exposure, and it doesn't even need penetration. Skin to skin contact lang, pwede na.
Oh, wow.
Yeah.
So yung mga other, avenues like of sexual activity, for example, oral
Yes.
sex,
Yes,
that's
it can
possible.
actually make them, that's possible. Or kahit yung skin to skin lang, touching lang ng kunyari, genitalia to genitalia, that can actually um, pass on the virus already. So,
Right. So genitalia to
mm.
genitalia. But when you say skin to skin, it doesn't mean genitalia to like
To
another
hand.
part of the skin. Yeah, to hand or something like that.
Pwede, pasa-pasa, kaya lang kasi we're talking about genitalia to genitalia or oral to genitalia. Kasi mucosa to
Okay.
mucosa. Mm,
Okay, mucus makes more sense.
mm.
So, and
Yes.
then doctor, yung birth control pills, does it have something to do with the pill?
Okay, they
Like,
actually, studies have shown that you can be a little more prone because of all the hormonal content of the pill. However, it's really more of, again, number one, if you have a family history, and you're taking the pill of cancer and you're taking the pill, you're more prone. And then, pero it's really more of the practices. Kasi I'm not saying naman that women who are on the pill are more promiscuous, but it's just that it gives you, taking the pill gives you a little more parang safety net. So, ang feeling mo, protected ka. So, you become a little more risky. So, medyo mas madalas ka makipag-sex. So, this is actually making you now a little more prone to cervical cancer. Oo. More
Right.
than the pill itself. Oo.
Right. Kasi yung pill protects against conception, but it doesn't
Yes.
protect against like STIs.
No, no, no.
Yes. So, Doc, my question dito from Megan MC who says, any thoughts on the menstrual cup?
Okay, this is a totally different topic already. It's a very good topic to discuss actually, Megan. But ako personally, although a lot of people are now becoming interested in menstrual cup kasi ano siya, greener siya. So lesser use of trees and stuff. Kaya lang ako personally, whatever you put inside the vagina will actually make you a little more prone to infections. Uh, although although the people who actually use it will argue with me na they sterilize naman and everything. But sa akin kasi anything you put inside is still a medium for entry of infections. So there.
But not cervical cancer naman, Doc, or HPV.
Not cervical cancer, no, no, no. But that's just my personal take on it. Oo, yeah.
Okay. So, Doc, what are the different types of cervical cancer?
Okay, there are technically 3 types of cervical cancer. Yan, ito, that's the one in the screen, the squamous cell, which is the most common. It's around mga 80%, a little more than 80%. It actually now, itong cancer na to, it starts in the thin lining in the lower part of the cervix. Adenocarcinoma, which is a little more toxic, and it comprises around a little less than 20% of cervical cancer. It starts in the glandular areas, yung areas na nagpo-produce ng mucus, which is the upper part of the cervix. And then there could be the mix. So cancers that have a mixture of squamous and adeno type of carcinomas.
Right. So, Doc, but they all are from basically the same cause, no? And then the same treatment?
Yes.
Okay. So,
Okay.
up here on the slide, we have like the progression of cervical cancer. So could you explain this for us, Doc?
All right. Okay. So this is a little technical already, but there are different stages. Every cancer, iba, may mga stage yan eh. Yun yung mga naririnig nyong stage 1, stage 2, stage 3, stage 4. Wala, mamamatay na. Di ba yung ganun? Or starting pa lang. So meron tayong tinatawag na carcinoma in situ. Meaning, hindi mo siya makikita, pero pwedeng sa pap smear ma-pick up siya kasi sa microscope mapipick up yung cell that causes actually cancer. Yung stage 1, usually ito yung depth of invasion tsaka yung size lang ng tumor, but it's confined to the cervix. So dun lang siya sa cervix mismo. Yung stage 2, ito na yung nagsispread na siya sa vagina o kaya sa mga areas na malapit sa cervix. So ganun lang siya. Stage 3, medyo ando na siya sa abdomen na, sa mga malapit na organs na. Stage 4, kumalat na siya. Okay. So, ganun lang siya.
So, Doc, at stage 2, can it be seen without a pap test?
Yes. Stage 2, you see already you can see the, what do you call this, the lesion already. Actually, stage 1B, pwede na eh. Kasi it can be from 2 to 4 centimeters already. So, you just imagine, para siyang, para ma-imagine mo, ang grape 3 cm. So, a little smaller than a grape, a little bigger than a grape. So, i-average lang natin. Size ng grape, andun sa sa kwelyo ng matres mo, ganun, makikita mo na sa stage 1B na yon. Ang stage 2 kasi, medyo ganun din ang size ng tumor, pwedeng mas malaki, tas pwedeng involved na yung vagina. Stage 2, ayan na yung stage 2A, the upper two-thirds of the vagina, pag 2B na, pati yung lower part of the vagina, or yung katabi ng areas ng cervix.
Right. And then, so Doc, how would we go about diagnosing this?
Okay, there are several things that we can do actually. Number one is pap smear. Okay. Pwede ito. Sige, dito sa slide na to, by manual examination. So, you go to your OB. Punta ka sa OB mo, i-examining ka namin, mag-IE kami or internal exam. Ang by manual exam, ibig sabihin lang, yung isang kamay namin, nag-IE or internal exam, yung isa nasa taas ng tiyan, tapos kinakapa namin ngayon kinakapa namin yung uterus, kinakapa namin yung ovaries mo, kinakapa namin yung cervix mo. Tapos, yung speculum exam, yun yung may ipapasok kami, sabi nga ng mga tao, yung parang doc, yung, diba, it's a special
Yeah.
device. Yeah. Tapos, yan, yung ganun siya.
It looks like a duck beak.
Yes. So, pwede siyang steel, pwede siyang plastic. Okay, so ipapasok namin yon. Anong ginagawa namin? Sinisilip namin yung cervix, yung itsura ng cervix mo. Okay, so this is bimanual pelvic exam and speculum exam. With this, pwede na kami, kung medyo malaki na yung bukol, meron na kaming pwedeng makapa or meron na kaming makita. So, next will be, pap test, pap smear. Okay, pap smear, hindi ito, kasi ang connotation actually ng mga pasyente sa pap smear, Dok, lilinisin mo ba ako? Lilinisin mo ba yung kwelyo ko? It's really more of not cleaning pero kukuha kami ng sample ng epithelium ng cervix tsaka ng vagina. Tapos ipapadala namin yun. Minsan linalagay namin yun sa slide, makikita mo, meron kaming cotton pledget, yung panglinis ng tenga na mahaba. Kukuha kami ng sample, lalagay namin sa slide, or meron kaming tinatawag na liquid prep na may special medium siya, na may cytobrush kami, yun yung pangkuha namin ng sample, tapos linalagay namin sa medium. Same thing, babasahin ng pathologist kung anong nakita, tapos sasabihin sa amin kung meron bang infection, meron bang cervical cancer. Ang pap smear is mainly for screening for cervical cancer. And then plus factor na may nakikitang infection or wala. Okay.
Doc, actually, so, sorry, go ahead. I thought you were finished.
Yes. No, I'm done.
Yeah. I just wanted to ask about yung sterile speculum and the pap smear. I know that a lot of people will think that it's a bit invasive, no? So, a lot of women are generally scared of it, especially considering, we don't really have that many women actually getting these tests. Pero,
yes, they don't.
Yeah, so what can you say, Doc, to those women who are scared of it? Is it scary ba? Is it painful?
Okay, yun nga yung nagiging problem. A lot of people, waive doing the pap smear yearly kasi nga natatakot sila. Kwento, alam mo, pasa-pasa, hala, ang sakit niyan, ang sakit, diba? But alam mo, I'm not going to say it's not painful, okay? I'm just going to say it's uncomfortable kasi may ipapasok sa vagina mo. But if you work with us, yun yung lagi ko sinasabi sa mga pasyente ko, if you work with me and you try to relax, kasi the more tense you are, na pag may pinasok ako, magko-contract yung puwet mo, hindi ako yung masasaktan. Ikaw ang masasaktan kasi ikaw yung merong instrument sa loob. But if you try to relax, mabilis lang to, sisilip lang kami, kukuha kami ng sample, tas labas na kami. The more tense you are, the more tatagal, the more kaming magsa-search, hahanapin namin yung cervix kasi kailangan namin makita, the more siya magiging very traumatic. So, and then, I usually, like, when I do pap smears, I talk to my patients, kwento-kwento kami, para next thing you know, tapos na. Ay, Doc, tapos na ka. Kasi nagkwentuhan lang kami. So, siguro distraction is, I think, needed sometimes.
Yes. So, Doc, just so that they can have an idea, would it be comparable to anything then, like, people have obviously inserted stuff up there, like, for example, a tampon or a menstrual cup or like during intercourse. So is that comparable to
it is comparable. Yeah, the discomfort is like, sabi ko nga I'm sorry, paano ba? Baka bigla akong di ba? Baka bigla akong ma-screen, di ba? Okay, sabi ko nga sa kanila, para siyang contact na wala yung enjoyment. So, papasok lang. So, ganun din. Or parang you're inserting a menstrual cup. So, may konting dilatation. Di ba? Pero, sabi ko nga, the more relaxed you are, the faster we get to finish the procedure, the more it's going to be easier for you.
Right. Well, I think, Doc, with the increasing trend of the use of menstrual cups, more and more people should be less scared na, no? Kasi it's just like a
Yeah.
menstrual cup, yeah.
Yes.
Doc, what about for women that, I know that this isn't really common, but for women with a condition of they have contractions, where it really just like tenses up sometimes. I forgot what the term is for that, Doc.
Vaginismus? Vaginismus?
I think that's the one. I think that's the one. So how do they have these examinations?
Well, that's one of the difficulties that we have pag medyo sobrang tense yung patient. So, yun nga, it's really up to, kaya nga it's good to have like these tests done kasi medyo very intimate with the doctor that we trust. Okay? With somebody na alam mo yung, kumbaga, lagi mo nang nakikita, kaya lang sasabihin naman ng iba, doc, 'di ba? Part ng APE. So, as doctors, we try to make you relax and then you prepare na lang yourself. Instead of thinking thoughts na parang masakit siya, nakakatakot, you try to convince yourself na madali lang to, mabilis lang to, pag nag-relax ako, mas mabilis yung test. So, siguro, na lang, tulungan na lang talaga. Pero kung talagang it's difficult, sometimes although it's not ideal, but, kasi we need to view the cervix. However, there will be times na, sige, just to do the pap smear, we insert the cotton pledget, get a sample, guided by our hand, tapos we send it to the laboratory. But that's not the ideal way, ha? Baka biglang may nanonood sa akin ditong ibang OBGYN, biglang sabihin sa akin, ano bang sinasabi ni Doc Mitch?
I think you're fine, Doc. So we have other tests over here.
Okay, we have the HIV, it's the HPV. HPV test. Okay, yeah. So the HPV test, it's like pap smear, para rin siyang pap smear, kaya lang may special medium that will now detect kung meron kang HPV or wala. So, syempre, mas mahal siya ng konti kaysa sa regular pap smear. Pero meron ang available ngayon. Yeah.
So, Doc, what's more effective then? The HPV typing test or a regular pap smear?
Kasi HPV is more of like we do this for those who are at like high risk and we are suspecting. So we do the HPV test. But most of the time we do a pap smear. May napipick up na rin doon naman. Pero kung may budget yung patient, we do combine. Pap smear plus HPV testing. Yeah, oo.
So then we have colposcopy. Colposcopy.
See, colposcopy is, it's hard to say it, di ba? So, colposcopy is para siyang may malaking microscope, magnifying glass. So, pasok namin, we look at the cervix, so, minamagnify namin yung itsura ng cervix, tapos para we can see kung merong lesions. Tapos from there, we can actually already do a biopsy kung meron kaming makitang abnormal area. So there. So that's colposcopy. So there we do either punch biopsy or cone biopsy. There are different kinds of biopsy. So yeah, we do that now. So that's colposcopy.
Okay, Doc. So
but Luisa, can I just add, sorry, in rural areas na hindi available ang pap smear, we actually recommend the single visit technique using the visualization inspection with acetic acid or the VIA. So kasi dun sa VIA, titingnan ka, may speculum, lalagyan ng acetic acid yung cervix mo. Pag merong higher uptake, kumbaga pumuti yung isang area, cryotherapy na agad, treatment na kaagad. Kasi, most of the time, mga pasyenteng andon, yung hard to follow up, yung kumbaga hindi na babalik sa'yo. So, yun, merong mga ganon. So, in lieu of a pap smear, kung walang available na pap smear sa isang center or isang district hospital or medyo malayo talaga sa kabihasnan, pwede nang gawin yung VIA. It's actually part of the DOH program. It has been introduced early 2000 na project already, and it's actually supported by the POGs.
Oh, okay. So I think that's perfect for our viewers. If you are, if you don't have access to a pap smear, or you're very, 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 very terrified of a pap smear, then my options na no that are supported by our DOH.
Yes.
So, Doc, what about treatment options? So if I take the acetic acid test and then treatment na agad, what kind of treatments will I be expecting?
All right, we can do pag acetic acid kasi VIA, pwede mag-cryotherapy. So, kumbaga if-freeze mo yung area na yon, and then hopefully after that mag-thaw siya, mag-fall out na yung cells na yon. Yun yung cryotherapy. So, iba-blast mo ng malamig na para siyang basta if-freeze mo siya. So, yun. Or pwedeng surgery, or pwedeng i-biopsy or cone biopsy, tatanggalin mo na yung area medyo mas malalim ng konti, and hopefully makuha mo na yung buong lesion. Other more advanced surgeries are TABISO, or the total abdominal hysterectomy, with bilateral salpingo-oophorectomy, wherein we remove the uterus, the ovaries, the cervix, and then merong type na radical hysterectomy. So, depende na yun sa extent na gagawin. Meron din naman na mga surgery na cervix lang ang tatanggalin. Ang tawag doon, trachelectomy. Tapos yung iba, depende, ang treatment talaga kasi, Luisa, is dependent on the stage. Okay? There are some patients who just undergo chemorad, meaning radiation plus chemotherapy. What is the difference between radiation and chemotherapy? Ang radiation, it's very high intensity na mga radiation, okay? Na binablast yung cells na abnormal, and then pinapatay niya to or tinitigil niya yung pag-spread. Ang chemotherapy naman, gumagamit siya ngayon ng chemicals or medicines that either pwedeng sa IV or IM or oral na binibigay para patayin naman yung mga abnormal cells. Meron din na tinatawag na direct therapy, meaning meron lang ina-apply dun mismo sa abnormal cells para hindi affected yung other cells. Kasi chemo and radiation, generally, buong katawan affected. Manghihina ang pasyente initially, minsan nasusuka, naduduwal, sumasakit ang ulo, minsan nagbabawas ang buhok. So, maraming mga side effects. Pero, yun nga, your doctor will be discussing your options depending on the stage of your cancer. So, depende sa stage ng cancer ang treatment. It's not a one thing cures all.
So, Doc, I noticed when you were talking about, like, for example, the surgeries and these treatments, they affect a lot of other areas, aside from your cervix. Like, for example, yung surgery that you mentioned, you remove your everything, your ovaries, and then your uterus. So, Doc, what if I still wanted to have children? Are there any options here that will allow me to get pregnant and give birth?
Okay, that's a good point, Luisa. Say, for example, for those young women na may cervical cancer, tapos early stage naman, pwedeng chemoradiation lang muna, and then we just give advice on when she can actually start trying to get pregnant. Kasi mas radical yung surgery. Pag surgery, tanggal na talaga lahat. So, pwedeng medical first ang treatment. Yan.
Okay. How about the cone biopsy, Doc? If you take away a big chunk of my cervix, am I still able to have children?
Yes, because the baby will stay in the uterus. Although we actually are, kumbaga, you are at high risk of what do you call this, preterm delivery, kasi pwedeng mag-open yung cervix na yon anytime. So mas lang talaga, medyo mas binabantayan namin yung mga patients na ganon, na medyo nag-cone biopsy, so meron ng konting problem sa cervix kasi baka incompetent cervix, mag-open siya, mag-dilate siya on its own, na hindi pa naman dapat, malaglag si baby. So, yun yung mga special cases wherein mas madalas ang check-up, mas madalas ang ultrasound, tsaka meron kaming mga ginagawang ibang procedures just to make sure that, she delivers a healthy baby
Right.
to term.
Doc, yes. Doc, speaking of pregnancy, I know you said that most cases of cervical cancer take a few years, no? So is it possible that I'm in the early stages of cancer and I get pregnant and deliver a
Yes.
healthy baby?
Yes, it is. It is. Yun nga. Tapos after that, yung options will be discussed with you whether you're still desirous of another pregnancy. And so we become a little more conservative with the management. Again, depending on the stage. Pero kung medyo, alam mo yon, it gets to the point na pagdating ng manganganak ka na, medyo advanced na rin yung stage. Of course, ang priority natin is to save the life of the mother. Diba? So there.
Right.
So deliver the baby and then do whatever is necessary para sigurado na okay si mommy.
Yes. So, Doc, I think we touched briefly on it in the beginning. Well, how do we prevent cervical cancer?
Okay, actually, cervical cancer is very easy to prevent and very easy to cure if you get screened regularly and you get vaccinated as early as possible. So now nga actually recommend na from 9 years old, nagbibigay na ng vaccine, ng HPV vaccine.
9 years old for men and women. Again, just a reminder to our viewers.
For boys and girls, yes. But there are 2 types of vaccines now, ha. May isa lang na type na pwede sa mga lalaki. So your OB will know that. And your pediatrician will also know that.
Do you go for if I have like a son, do I go to a pediatrician or do I go to an OB regarding this vaccine or urologist?
No, it would be best to talk to your pediatrician about it kasi sila ang vaccination. Some patients, they refer to the OBGYN.
Okay, thanks.
So,
yeah. Yes. So what are other ways to prevent this?
Yung wait, ang pap smear, ang schedule natin ng pap smear. Personally, I usually within 3 years of becoming sexually active, you need to get a pap smear. Kasi yung iba, ayaw magpa-pap smear or Doc, hindi pa naman ako kasal, so ba't ako magpa-pap smear? But no, within 3 years of becoming sexually active, you need to get a pap smear. Tapos, ang recommendation ngayon is 3 years na sunod-sunod, yearly. Tapos, kung 3 taon na yon, negative ka for infection or any form of cancer, then pwede nang every 2 to 3 years. Kaya lang, again, this is my personal take on the screening. I always tell my patients, get screened na lang annually. Make it a birthday gift for yourself na every year you get screened kasi mas maganda na, di ba? Luisa, di ba? I don't know if you will agree with me. It's better to be a little more OC and know what's happening in your body kaysa get surprised after 3 years na meron na palang bukol o meron na palang problema, 'di ba? Oo, there.
Yes. I would rather get checked more often so I can catch whatever at an early stage.
Yes, exactly.
Yes. So, Doc, what if you aren't sexually active or you've never been sexually active? Is it still required to get a pap smear?
Okay. We recommend by 50 dapat naman siguro kahit na hindi ka active, you get a pap smear na. But the usual recommendation is at 35, whether you are sexually active or not, it is advised that you get a pap smear.
Right. Okay. And then what are other ways of preventing, Doc?
Okay, sige. Ito na. Medyo mga controversial suggestions na from Doc Mitch. Okay. First, if you can delay. Diba? I am scared. Baka biglang may tumawag sa atin na, oh my God. Diba? Saying things live. But number 1 is, if you, for the young women or young men and women who are listening to us now, if you can delay the first sexual intercourse until you are older, it would be better. Older meaning older than 20, diba? So, if you can delay if you can limit the number of partners that you have, if monogamy, if you're open to monogamy, better, diba? Diba? One partner will decrease your chance big time. One partner lifetime. So there. Tapos safe sex. Kung talagang wala talagang ano yung kumbaga this is your expression. Kasi there are other ways of expressing your love. But if this is one way of you expressing your love, then it's better to be protected. You can use condoms. Sabi ko nga kanina, what is dental dams? I'm an OB but I don't know it. Okay. ano pa? So sabi sa akin kanina ni Luisa, it's like a female condom. So
Oo.
see, I'm
I think
learning
that's
also
from
there.
my Google. That's from my Google
I'm
research as
learning also.
well.
So
We're piecing together
safe
things.
sex, yeah. So safe sex is very important. But however, yun nga yung sinasabi ko, 'di ba? It doesn't need the penetration to get the HPV. Skin to skin pwede. And ang condom will only, cover the penis. It does not cover the scrotum or paano kung may HPV doon? So, touch na, pwede. Diba? So, kaya nga, as much as possible, kung pwedeng limit the sexual activity, the better. Oo.
Right. Stick with monogamy.
Yes, and if you can, diba, if you can just go be active when you're married, then better. Okay, another is now the next few slides I will be or talking about is improving your immune system. Okay, so kasi nga 'di ba sabi ko at the start, Luisa, the virus actually the only way we are going to fight the virus, and this goes for COVID also, is if you have a very very resilient immune system. If you have a good immune system, you can fight anything, diba? Even if you get exposed to a lot of things. I'm not saying you're Superman or Wonder Woman, na hindi ka magkakasakit. But the manifestation of the virus will not be as bad as those who are, kasi yung mga namatay sa COVID, most of them are those na medyo may comorbidities na matanda na or may sakit talaga, diba? So, one is stop smoking. Okay, again, some people will kill me. Okay? Smoking technically decreases hindi ganun kaganda ang circulation. Kasi kung this is your artery, smoking makes it a little smaller. So yung blood flow na dapat maganda, hindi nagiging maganda. So pag pangit ang circulation, wala din yung mga, alam mo yun, yung mga nagpo-protect sa katawan natin to help us fight disease, right? Plus the fact na when you smoke, you age faster, your skin age faster, 'di ba? So there. Next is, eating healthy, well-balanced meal. You have to have your share of gulays, your protein sources, pork, chicken, although ang mahal na mga bilihin ngayon, di ba? Seafood. So, well-balanced meal. Kailangan laging may fruits and vegetables every day. Dok, ang mahal. But, if you can actually make your plate, madaming choices, 'di ba? Tapos alam mo 'yun yung tipong hindi naman kailangan salmon lagi, 'di ba? 'Di ba there are a lot of healthy like malunggay, ang daming mga healthy kalabasa, 'di ba? Maraming mga healthy sources na maraming healthy food. Sleep is very important. Getting 6 to 8 hours of sleep a day and sleeping within the window period of 10 p.m. to 2 a.m. is very important because 10 p.m. to 2 a.m. is the time that your body replenishes. It's the hormones that you used up during the day. So if you don't get to sleep regularly during that time, ganun din. If you lack sleep, yung response mo sa bakuna mas low. Okay,
Yes.
studies have shown that already. So, pag kulang ang tulog, hindi ganun kaganda ang response mo sa bakuna. So, kung ikaw puyat-puyat, tas nagpabakuna ka ng flu, kunyari, tas nagkasakit ka pa rin ng flu, do not blame the flu vaccine. Blame yourself because you're not sleeping regularly. Okay, so ganun. So, well-balanced diet, and then, taking supplements actually will help. Taking your vitamins with zinc, plus taking immune boosters that actually help you fight your body fight free radicals, yun ang sobrang important. That's why ako din, this is not, I'm not going to say this, Luisa, now because you got me to talk about cervical cancer and stuff. But I've been a user of Organique, okay, for the longest time. And it helped me a lot. And alam mo yon, I'm a doctor. In the pandemic, I was very busy seeing patients. And so far, I mean, I'm doing well. And then even before the pandemic, so yung sakit, hindi ganun ka, alam mo you get a little sick, but it's not like it brings you down talaga. So malaking tulong na you have supplements talaga to help, your body fight the free radicals. Ano ba itong mga free radicals na sinasabi ko? Ito yung mga nagda-damage sa mga cells natin. Na pag dinamage mo yung normal cell, so meron na siyang konting lamat. Pag nalamatan yan na yung pwedeng maging cancer eventually.
Yes.
So yun.
And then,
Yeah.
Doc, I think what you were saying earlier is that again, 75% of adults will get HPV in their lifetime. So then, the reason that what's between HPV and cancer is our immune system.
Yes, exactly. Uh-uh.
Yes. And then, Doc, I think the last point over here, is our vaccine. So we already talked a lot about the vaccine and how it can be helpful to us. So I guess I just summarize up the points of the HPV vaccine.
Okay, HPV vaccine is very important now. May dalawang klase ng HPV. Ay, hindi, tatlong klase na. Dalawang brands, pero tatlong klase. Yung isang brand, ang tawag sa kanya bivalent. Ano ibig sabihin? May dalawa siyang strains ng HPV na tina-target. Okay, which is the 16 and 18, which is the more common strains that are causing cervical cancer, and then that are present here in the Philippines. Yung isang brand naman, may dalawa siyang klase. Yung quadrivalent, it attacks 4 strains. Yung 2 strains, yung 16 and 18. Tapos yung plus factor niya, yung 6 and 11. If you remember yung sinabi ko kanina, yung nagkukos ng genital warts or yung kulugo dun sa ari natin. Tapos yung isa naman, nonavalent, it attacks 9 strains ngayon. Syempre, if you ask me, mas okay yung 9 strains kasi mas madami na siyang coverage. Although, syempre siya ang pinakamahal. Okay. Yung 4 strains, okay na siya kasi kahit yung 2 strains, diba, may cross-protection na kasi with the different strains of the HPV. So, it's just that, yun nga, ginawa lang yung 9 strains para mas targeted yung 9 top strains ng HPV that causes problems. Sabi ko, di ba kanina, more than 100 types, may 12 na nagkakos ng cancer. So, there.
Right. Okay, Doc. Well, I think that brings us to the end pretty much. Can we just, let's go through some of the questions, because I'm sure this is a topic that a lot of people are mostly unfamiliar with, no? Despite it being so prevalent dito sa Pilipinas, like in terms of our numbers. So I'm just going to go through some of the questions. So we have here one question from Gian Valenton, who says, my partner and I are unsure if we have STIs and are pretty confident we haven't been exposed to people with it. We plan on getting tested and all, but should we already act as if we have STIs and cut off our intimate relations with one another, I guess, before being tested, Doc?
Cut off? Before kasi you get tested naman, lalo na with the pap smear, we advise that there shouldn't be any contact for at least 2 to 3 days so that the specimen will not get contaminated with the sperm. So it would be good, if you're getting a pap smear, it would be good to actually cut sexual contact first for at least 2 to 3 days. The rest of the other tests naman do not need you to stop having intimate relationship. However, if you guys are scared that you have STI, then it would be best to get tested nga. Tama yun. That's the right move.
Right. And then, paano po ba malaman if healthy ang vagina po, Doc? This is from Chris V. Marie.
Okay. Healthy vagina means that your ecosystem is intact. 'Di ba? May ecosystem ang vagina. Alright. If you're not experiencing abnormal discharges, and you have regular pap smears that say that you don't have any infections, then you have a healthy vagina. So the secret is keeping the acidity of the vagina. Eh. So choosing the right feminine wash is very important. Not being too clean. Okay? The problem of Filipinos is we're too clean. Diba? Especially during this pandemic, every time you go to the washroom, talagang wash, 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 wash. Diba? So, twice a day is enough unless na you do number two in the middle of the day. But twice a day of using feminine wash is good enough. Avoid using soap in the feminine
Mhm.
area. Mm.
Okay. So Doc, we have one more question here from Andy who says, kapag po ba may PCOS, may possibility po ba na maging worse ang result?
Worst ng result ng ano kaya? Ng pap
I
smear?
think, I know, I was thinking maybe they mean cervical cancer or
Okay.
HPV, or maybe the
All
passeroles.
right. Okay. When you have PCOS, we always like say that once you're PCOS, you're forever PCOS eh. So you
Mhm.
need to get treated because ang mas problem ng PCOS kasi is yung sequelae niya na this can actually, you can have like you're more the earlier you have PCOS, the higher your chance of getting stroke,
Mhm.
developing diabetes and cardiac problems. And studies have proven this already. In terms of cancer, there are some studies, although mixed pa rin. Although I'm not an oncologist, ha, so, but it may increase the chances of ovarian cancer.
Mhm.
So, ang takeaway na lang dyan is it's best to have regular checkups kasi most of the patients now kasi PCOS, irregular ang cycle, binigyan ng pills, nag-normalize, di na bumalik. Babalik lang pag nag-irregular na ulit. Okay, so that's the wrong attitude. Once may
Right.
findings, it would be best to do an annual checkup. Sabi ko nga, birthday gift or New Year's gift every January, gawin mo ng routine yun.
Okay. And then one more question from me, Doc. So women have to get an annual checkup, no? Does that mean that men have to get, maybe not for the cervix, but for HPV,
Yeah.
or what other cancers that might be associated with that?
All right. Ang difficult kasi it's very hard to test HPV in men. Okay.
Mm.
Mas nagma-manifest kasi ang women than men. But if, say, for example, their partner is positive for HPV, then chances are he has HPV also. So, ang ano na lang dyan is get vaccinated together with your partner, with your wife or your girlfriend or basta your partner. Sabay na, make it a couple thing, diba? Couple goals. To get vaccinated.
That can be your anniversary gift or
Diba?
Valentine's.
Tapos ikaw magbayad.
Yes. Okay, Doc. So we actually ran a bit over time. I think there were a lot of questions and new insights for us today. Thank you so much for joining us, Doc. So if you could just give us your big takeaway today, what would that be?
Okay. Okay, so as I've said kanina then, Luisa, diba, while we were talking, well, we are being very concerned about, the vaccines that we need to get for COVID and stuff. 11 women, Filipino women, every day are dying of cervical cancer. Okay, an average of 3,000 plus women die every month. And an average of 7,000 plus get diagnosed with cervical cancer. It's very important that you take care of your health in general. It's not just like one facet. Eh. So, see your doctor, have a regular checkup, make that as your gift for yourself. Alagaan mo ang sarili mo para maalagaan mo ang mga mahal mo. Okay? So, there.
Okay. Thank you so much, Doc, for
Thank
joining us here
you.
today. I really
I had
enjoyed
fun, Luisa.
yeah, I loved our conversation. And I hope we can see you, Doc, for more OB/GYN related needs,
Yes, I
especially
would
in
love that.
yes. All right. Take care, Doc.
All right. God bless you all. Stay safe. Bye-bye.
Thank you. Okay, so sorry again for running over time. Let me just go straight ahead to our Olani. So we invite you to join Olani resellers here at Olani PH. Become our official direct seller to share the health and spread the wealth for our Organique acai products, as well as our other products such as our snack lines. So as we wrap up, I just wanted to announce the winners for today's game. And the winners are... Oh, no, sorry. Here's our mega sale. So yes, March just started. Mega sales coming up 3/3. You can save up to 1,500 pesos. You can check us out on Shopee for this amazing deal. Now we get to the winner. So the correct answer is true. So congrats to everyone who answered true. Now even more congrats to the winners of our gift pack, who are, dun, 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 there's my drum roll, si Catherine Sikat, Min Padua, Cabrera Christine, Ixhang Acohido Barut, and Joanne Nardo. So congrats to all our winners. Our team will contact you as to whether you prefer the acai coffee or the acai choco. And I hope you get to enjoy these, and as well as the capsules natin, so that you can boost your immune system to prevent cervical cancer. So that brings us to the end of today's episode. Thank you for hanging on tight with us. I know it ran a bit long, but I hope it was very informative to you. So I'm just going to wrap it up and say good night. And I hope you enjoy the rest of your week.
Wellness Wednesdays with Organique. We care because you matter.